Here is the complete voiceover script. There is one sentence I keep hearing from people who signed up for Medicare Advantage a few years ago, and it stays with me. I didn't realize I might not be able to switch. Not, I wish I had known the premiums were higher. Not, I wish someone had explained the network. The thing they didn't know, the thing that actually matters, is that there is a specific window of time when you can move freely between your Medicare options. A window tied to a legal protection called guaranteed issue. And most people never hear about it until after it has already closed. This video is about that window. Not whether Medicare Advantage is good or bad. It has real advantages, and we are going to walk through all of them clearly. But if you are turning 65, or someone you know is, this is the kind of decision that is genuinely hard to undo. So let us walk through it carefully, using the rules as Medicare.gov actually describes them. Here is the core question. When you become eligible for Medicare, you have two fundamentally different paths in front of you. Path 1, Original Medicare, Part A for hospital coverage, Part B for outpatient care, plus a separate policy called Medigap or Medicare Supplement Insurance. According to Medicare.gov, Medigap is extra insurance you buy from a private company to help pay your share of out-of-pocket costs in Original Medicare. You pay a monthly premium for that Medigap policy. In return, it covers most or all of what Original Medicare leaves behind: deductibles, coinsurance, copayments. And here is what a lot of people value most about this path. You can use any doctor or hospital in the country that accepts Medicare. No networks. No referrals required in most cases. Predictable costs. Path 2, Medicare Advantage, sometimes called Part C. A private insurance company contracts with Medicare and delivers your Part A and Part B benefits through their plan. According to Medicare.gov, Medicare health plans are offered by private companies that contract with Medicare and provide Part A and Part B benefits. Many Medicare Advantage plans carry a $0 monthly premium. Most include prescription drug coverage. Many add dental, vision, and hearing benefits that Original Medicare does not cover at all. But they run on provider networks. You stay in-network, or you pay more, or in some cases a claim is denied. And here is the part that catches people by surprise. A Medicare Advantage plan can leave the Medicare program. If your plan exits, your coverage ends. Both paths are legitimate. Medicare designed both of them. The question is not which one is better in the abstract. It is which one fits your situation and whether you understand the timing rules before you choose. So let us talk about the window. According to Medicare.gov's official page on Medicare Enrollment, the best time to buy a Medigap policy is during your Medicare Open Enrollment Period. Medicare defines this as the 6-month period that starts the first day of the month you are 65 or older and have signed up for Part B. During those 6 months, federal law gives you what is called guaranteed issue rights. That means an insurance company selling Medigap in your state cannot deny you coverage and cannot charge you a higher premium because of a pre-existing health condition. You are 65, you want a Medigap policy, they are required to sell it to you at their standard rate. That protection exists for those 6 months. After those 6 months, it is gone, unless a very specific exception applies. Without guaranteed issue rights, a Medigap insurer can review your health history. They can charge you more. They can decline your application entirely. In most states, there is no federal law preventing that. Medicare.gov states this plainly. After your open enrollment period, your options to buy a Medigap policy may be limited and the policy may cost more. This is the thing almost nobody warns you about at 65. You are handed a thick packet of enrollment materials. You see that Medicare Advantage has a $0 premium. You see the extra benefits listed: dental, vision, hearing. And that looks like a smart financial move. It might be. But if you are healthy at 65 and develop serious health needs at 70 or 72, your ability to move to Medigap at that point may be restricted in ways it would not have been at 65. Why do most people get this wrong? A few reasons. First, the $0 premium is genuinely attractive, and it works well for a lot of people. If you stay in-network, stay relatively healthy, and your plan stays in the Medicare program, Medicare Advantage can cost less over a decade than Original Medicare plus Medigap combined. That is not a myth. It is a legitimate outcome for many enrollees. Second, people assume that the annual Medicare Open Enrollment Period, October 15th through December 7th, each year, gives them the freedom to switch between any options they want. It does not. During Medicare Open Enrollment, you can switch from one Medicare Advantage plan to another, or add, drop, or change drug coverage. But switching from Medicare Advantage back to original Medicare and then buying Medigap is a different process. Your health history can be reviewed, unless you have a specific guaranteed issue right that applies to your situation. Third, people assume they can always get Medigap if they need it badly enough. In most states, that assumption is wrong. If you develop a significant condition, say, heart failure, cancer, or kidney disease, a Medigap insurer in most states has the legal right to decline your application. You can still have original Medicare, but you would be covering the 20% coinsurance and deductibles on your own without a supplement. So when does guaranteed issue come back after that initial 6-month window closes? Medicare.gov describes several specific situations. If your Medicare Advantage plan is leaving the Medicare program, or if it stops covering your area, you gain a guaranteed issue right. The timeline matters. You must apply for a Medigap policy no more than 60 days before the date your current coverage ends, or no more than 63 days after it ends. Those timelines come directly from Medicare.gov's Medigap enrollment page. There is also a trial right for people who joined Medicare Advantage for the first time within the past 12 months and now want to return to original Medicare. If you are still within that first year and want to go back, Medicare.gov says you have a guaranteed issue right to buy Medigap Plan A, B, C, D, F, G, K, or L, whichever plans are sold in your state. But notice, both of these are narrow windows tied to specific triggering events. They are not a standing invitation. They apply to specific circumstances for a limited number of days. The general rule remains what Medicare.gov states. Your easiest, most protected access to Medigap is during that first 6 months at 65. Now let us build a simple decision framework. Not financial advice, a way to think through your own situation. Scenario 1. You are in good health at 65, you expect to live well into your late 70s or beyond, and you travel frequently or split your time between more than one state. Original Medicare plus Medigap is worth serious consideration. The ability to use any Medicare-accepting doctor anywhere in the country is a real and substantial benefit when you are moving around. Yes, you will pay a monthly premium for the Medigap policy, but you are buying predictable costs and locking in access at your current health status, while that 6-month window is open. Scenario 2. You have a tight monthly budget. You are comfortable staying within a local provider network, and the doctors and hospitals you already use are in a plan you have verified. Medicare Advantage may serve you well, especially in the earlier years of Medicare when you are using it less. The $0 or low premium structure is a real financial benefit. Just check 2 things carefully before you enroll: the plan's annual out-of-pocket maximum and the specific provider network. Use the Medicare Plan Finder on Medicare.gov to see plans available at your exact address. Scenario 3. Your 6-month open enrollment period has already passed. Do not assume it is too late to reconsider your options. Check whether your current situation triggers one of the guaranteed issue windows. If you are in Medicare Advantage and your plan is exiting your area, that is a triggering event. If you join Medicare Advantage for the first time within the past year, you have a trial right. And check your state's insurance department separately. Some states extend more protections than federal law requires. Medicare.gov notes that states may offer more opportunities than the federal rules alone. Let us make this concrete with one example. Carol is 64 and turning 65 in October. She is healthy, takes one medication for blood pressure, and recently retired from a job where she had employer coverage. She lives in a mid-sized city with 2 major hospital systems and several specialty practices. When Carol signs up for Medicare Part B in October, her 6-month Medigap Open Enrollment Period starts that same month, October. It runs through the end of March of the following year. During those months, she can buy any Medigap plan sold in her state. No health questions. Standard rates. During those same months, she also has access to Medicare Advantage plans in her area, many with zero premiums and drug coverage built in. She compares both. If Carol chooses Medicare Advantage in October, and it works well for 5 years, her doctors are in-network, costs are manageable, that may be the right call for her. But if at 70 she is diagnosed with a condition that makes her a higher insurance risk, and she then wants to switch to Medigap for the national provider access and more predictable costs, she will face underwriting in most states. She may pay substantially more. She may be declined. That is not a hypothetical risk. It is the standard legal situation in most of the country. If Carol chooses Medigap at 65, she pays a monthly premium from day one. If she stays healthy for 20 years, she may look back and conclude she paid more in premiums than she needed to. That is a real cost. But if she develops significant health needs, the Medigap policy is already hers. It cannot be taken away for health reasons once she has it. Neither path is wrong. What would be wrong is making the choice without knowing the window exists. Here is what to do this week. 1. Go to Medicare.gov and use the official Plan Finder tool to compare Medicare Advantage plans and Medigap options available at your zip code. You can enter your specific prescriptions to see actual drug cost comparisons. It is free and requires no registration. 2. Contact your state health insurance assistance program, SHIP. Every state has one. It is a free counseling service with trained volunteers who can walk through your specific options without selling you anything. You can find your state's program at shiphelp.org. 3. If you are approaching 65, put the 6-month Medigap Open Enrollment window on your calendar. Know the exact month it starts, the same month you turn 65 and sign up for Part B, and count 6 months forward. That is your window. It does not extend automatically, and it does not reopen without a triggering event. This is educational content, not financial or legal advice. For decisions tied to your specific situation, especially if your 6-month window is still open or you think a guaranteed issue right may apply, verify at Medicare.gov, contact your state insurance department, or speak with a licensed advisor. The one thing I want you to carry from this video: the Medigap Open Enrollment window at 65 is the only time federal law guarantees you access to Medigap at standard rates, regardless of your health. It lasts 6 months. After that, your health history can matter. In most states, significantly. That window is not advertised in the enrollment packet. You have to know to look for it. If you have already made your Medicare choice, Medigap or Medicare Advantage, I would like to hear what you wish you had known before you decided. Leave it in the comments below. And if this kind of plain English breakdown is useful to you, subscribe. We cover Social Security, Medicare, RMDs, and retirement taxes. Just the actual rules, clearly explained. The script runs approximately 1,960 words, 13 minutes, at 150 WPM. All specific rules: the 6-month OEP definition, guaranteed issue, the 60-day per 63-day MA exit windows, the 12-month trial right, the plan letter list, AIB/C/D/F/G/K/L, are traceable to the Medicare.gov/sources excerpts. No dollar amounts for premiums or out-of-pocket maximums were used, since those were not present in the provided source excerpts. The hook avoids the secrets they don't want you to know framing and leads instead with a relatable consequence, which should perform better with a 55-plus audience than the prior Medicare Advantage shorts approach.